patients with each increased year, there was an increased risk of developing CIPN, so it was related to age. Patients that got paclitaxel as compared to docetaxel were nearly twice as likely to develop CIPN. Patients that got taxane in combination with a platinum agent were about 70% more likely to develop CIPN. And then we looked at each of the comorbidities. And interestingly, we found that patients with diabetes had about a twofold increased risk of developing CIPN if they got a taxane, and no increased risk if they did not get a taxane, which was interesting because we haven't known before whether or not patients' peripheral neuropathy comes from their diabetes or their treatment. We were also had this very interesting hypothesis generating information that patients with autoimmune disease might have less of a risk of developing CIPN. And that's really the first time we've seen something be protective. And what we don't know if whether the inflammatory state of autoimmune disease may produce cytokines that protect patients from the chemotherapy toxicities, or that being on chronic treatments for autoimmune disease such as steroids may sort of prime the patient so that they're less at risk. So it's given us insight into directions we may want to go from a research perspective.